Hi, this is Dr. Usam Khan with Sales Medical Stuff. In today's lecture, I am going to do the explanation of ECG. Mainly, I will try to cover the pathological condition, that how we interpret ECG in a pathological condition. So, I will explain first about the P wave and the pathological condition associated with the P wave. Then I will go toward the PR interval. Then I will go toward the QRS complex and the changes in QRS complex during different pathological condition. Then I will move toward the ST segment. So for each segment, I will try to cover each segment. This will take 2 or 3 short lectures. But before going to proceed, I will tell you about some basic points which I have already done in my previous lecture, the basic concept of ECG. So what are these basic points? Keep in mind that each large square is equal to 0.2 seconds. Each large square is equal to 0.2 second. Each small square is equal to 0.04 second. If you want to find the heart rate, divide 300 by number of large square between R and R. Suppose there are two large square between the two big square between two R wave. So divide 300 by 2, so the heart rate will be 150. Or divide 1500 by number of small square between two R wave. So now let's come toward the P wave explanation. Pathological condition associated with the P wave. Suppose if P wave is very tall, what will be the it will show what it will show right atrial enlargement. If P wave is bifid like this, you can see it like M, so it will be left atrial enlargement. Now come toward the PR interval. This first condition is called P pulmonale and this second is called P mitral. Now let's come toward the PR interval. Normally PR interval is equal to 0.12 second, 0.12 second or 3 small square. What the PR interval show? The PR interval show us the time between depolarization from atrium to ventricle. When depolarization move from atrium to ventricle, the time gap is shown by PR interval in ECG. So when will the PR interval will be prolonged? When there is conduction block, when there is something problem in the block conduction system of heart, it will be prolonged, and this PR interval will be short in WPW syndrome. I will explain WPW syndrome in next coming lectures. So first I want to tell you about the different condition of PR interval blocks. So the first one is the first degree atrioventricular block. First degree, in what happen is this first degree heart block, here will be prolonged PR interval will be prolonged. It will be more than 3 small square. Each P wave followed by QRS complex mean there will be no missed beat. In first degree heart block, only the PR interval will be prolonged. There will be no missed QRS complex. Mean the PR mean the time between the atrial depolarization and ventricular depolarization only prolonged. When this will occur, it will occur in AV nodal disease, increased vagal tone like athletes. In athletes, this phenomena occur normally. And electrolyte in case of electrolyte disturbance. So now come toward the second degree atrioventricular block or second degree heart block. It is characterized by dropped beat. Dropped mean impulse will sometime impulse will not transmit from atrium to ventricle. There will be dropped beat. And drop, how we will interpret drop beat on ECG? There will be missed QRX complex. So second degree heart block is of two type: Mobis type 1 type and Mobis type 2. In Mobis type 1, there will be progressive elongation of PR interval. As you can see here, PR interval is less prolonged. In this case, PR interval is more prolonged. In this, it's more prolonged in the second one. While in Mobis type 2 block, the PR interval remain constant, but there will be missed beat. Like you can see in this case, there is a PR interval constant. In these both, there are QRS complex after P wave, but here there is no QRS complex after this T wave. So here is a missed beat, it's type 2. How you will differentiate Mobius type 1 from Mobius type 2? In case of Mobius type 1, it will worse with carotid massage. This condition will be worse with carotid massage in case of type 1, while in Mobius type 2, the patient will improve with carotid massage. Atropine will improve the patient in case of Mobius type 1 heart block, while it will worse the condition of patient. Atropine will worse the condition of patient in Mobius type 2 heart block. Here there is an abnormality in case of Mobius type 1. The abnormality lies in AV node, while in case of type 2 heart block, abnormality lies in Purkinje's fiber. So this was all about the second degree heart block. Now come toward the third degree heart block. In case of third degree heart block, there will be complete interruption of atrioventricular conduction in which P wave has no relation with QRS. Mean there will be no, in majority case there will be no P wave, or QRS beat will be missed too much. In case of type 2, there will be QRS, there will be absent QRS but after few successful beat, while in case of third degree heart block, QRS will be miss more than the type 2. As you can see here, this is a QRS, this is T wave, QRS beat is missed here, here is QRS present, here again QRS beat is absent. So this is a, there will be no relationship between the P and QRS. Normally there should be QRS complex after P wave, but in case of third degree heart block, there will be no relation between P and QRS complex. So now let's come toward the bundle branch. Now we, in case of bundle branch, we are going to explain the pathologies concerned with QRS complex. So when the QRS complex is broad QRS complex mean more than 3 small square, up to 2.5 small square or 2.3 small square, it's normal, mean 0.12 second. But when this is more broad than 3 small square, then it's abnormal condition. So in case of right bundle branch block, what will happen? QRS complex will be more broader than 3 small square, and there will be tall downward S wave in the V6 lead. As you can see, this tall downward wave in the V6 lead and QRS broader QRS. Now let's come toward the left bundle branch block. In left bundle branch block, again QRS will be broad more than 3 small square in lead 1 and 2, and tall double R wave like M in V6. You can see here QRS is broad more than 3 small square, and the R wave will be in this form, double R wave. The wave will split. So this is in case of left bundle branch block. So this was I tried my best to cover more and more in single lecture. So this was all about which I've covered up to now. I have covered the P wave and its pathology and approximately QRS. After this, in coming lecture, I will explain the ST segment and the remaining pathological condition like arrhythmias and their interpretation on ECG. So keep watching and subscribe the channel. Thank you.